we are going to talk mostly about the colon, but if you want to get into the upper GI, we did a webinar on last week, Tuesday, upper GI imaging webinar, which really contains the materials that you need to apply what I'm going to tell you for the colon to the upper GI. So we kind of made a conversion course, right? Because a lot of people, and I think a lot of people in the West, they start out with their ESD in the rectum, really, because that's where the lesions are. The gastroenterologist. Right. So I mainly want to focus on endoscopic imaging and say how that relates to Celine's question of which lesions are for EMR and which lesions are for ESD. And I think that your question, Celine, is critically important, and the answer to it in the upper GI is that the majority of lesions are for ESD, right? So actually, the colon is another good place to start with the stratification, because in the upper GI, ESD has much more of a role, and often it's the decision between ESD and surgery. In the lower GI, so the main problem is that we know the majority of people cannot accurately risk stratify cancer. So why, PTN, do we want to do ESD and not EMR in the colon? What is the primary reason?
Why we would do an ESD?
Yeah, why would you say you've got a standard polyp in front of you, right? 20 millimeters in size. Mm-hmm. You could take it off with a snare. You might say, well, why? Yeah, I can take it off with a snare. What is the reason why you might decide, actually, that's not a good idea? So this guy, Malcolm Gladwell, had the idea of blink first impression, that it was important. And if we just look at this one, the center is depressed, the folds are drawn into the polyp, and the center is more red. And so my blink when I look at that is positive, and we can deconstruct why that is. But of course, that's me looking at this. And maybe someone who's never done polypectomy before looks at this and says, well, yeah, and this is another polyp, but they look at this and they think, so how can we do it better? Well, we can deconstruct our blink impression. So we can say, and this holds true, almost certainly also holds true for the upper GI, that there are some things, and there you can believe me or you can not believe me, but these people have also published these findings as that denote a positive blink. So what, for you, do you think we mean by a positive blink, PTN?
Well, positive blink is something that draws your attention.
But that's true. Translated into the pathological